Okay. Hi, all guys. We are the Group 10, and our Capstone project is about the hospital charge master. I'm Nikki Mu.
I'm Mia.
And my name is Serge.
So let's go on the next slide for the table of contents is the following. We will mention after when we discussions. So the first one is about the primary market research. So let's my partner to do this one.
Perfect. So what we ended up doing in order to get more information about ChargeMaster, the protocols, and how actually it works on more of a one-on-one basis, we ended up contacting Dr. Snezana Namomsky. She's essentially one of the individuals I met during my PharmD rotations, and she's a director of pharmacy at Los Robles Medical Center. So she gave me and our group a little bit of a breakdown in terms of how charge masters actually work and what is the essential process and kind of the step-by-step breakdown. And essentially in Los Robles Regional Medical Center, as with any other hospital, it provides transparency in pricing. That was ever since 2019 that she stated that the majority of the hospitals have to showcase their prices in order to be more transparent in their evaluations. And patients' pay is largely determined by their health insurance coverage. However, if the insurance doesn't cover certain procedures, you will be able to see an itemized price. It actually is broken down into procedure ID, into the HCP CPT codes, to the description of the procedure, and the gross charge that the hospital incurs. And if a patient does not have a health insurance, their financial liability will be determined by the actual you can see is at the bottom, discounted cash price or gross charges. And Los Robles, like all the other hospitals, along with the Thousand Oaks Surgical Hospital, since they're kind of two distinct entities when she told me, they both have their own PDF versions of the actual charge master that is provided. If you can go back just one slide, just back. Basically, it was a breakdown of the hospital's formularies, and it broken down into multiple steps. For secondary, perfect. So basically broken down HCP codes, description procedure, gross charges, discount cash price. And that was the example that she provided for me in terms of the hospital itself. And she gave an amazing breakdown and definition. Next slide. For secondary market research, we did end up finding a study. Essentially, it was a survey of hospital charge master transparency. This was pretty recent. They did a survey of about 15 hospitals, but only 11 reached out in 2021. And for all the way from January 2019 to 2021, what they ended up doing is they ended up kind of coalescing data. However, before we get into the actual secondary market research, in January 2019, Centers of Medicare and Medicaid Services ruled that hospitals had to increase health transparency pricing, or aka the charge master, like I mentioned previously, and like Dr. Snezana mentioned. The charge master charges varies across hospitals and have been documented to be as high as 10 to 20 times at different geographical regions, which is super extraneous and something I should punctuate. And do not necessarily reflect the total charge of an episode of care. Essentially, it's just a compounding notion of prices that the hospital has. And it does include the charge of like an appendectomy, individual charges for anesthesia, time for operating room sutures, and all of that is compounded into the charge master, which my colleagues will go over later. Next slide. But what the study did is the objective was to look at and compare hospital charge master data within local hospital markets. And what they did is 10 common hospital laboratory tests, medications, and procedures that they analyzed across variations of 11 to 15 hospitals. Only 11 reached out back. But what they ended up finding was that the examined items revealed a high variation in charges. And the largest charge variation for a laboratory test examined included almost a 2,600% difference between a partial thromboplastin time, which was like one hospital had an $18 surcharge for it, and the other one had 506. It was a huge geographical and monetary variation. For medications, there was like about an 18,000% difference for one tablet of amlodipine. For procedures, it was about almost 3,000 difference for like a circumcision. And one institution accounted for about 77% of the lowest prices, and another accounted for about 60% of the highest prices. And that image on the right-hand side shows you the variation between each of these institutions and how much they actually charge. And from here, I'm going to go ahead and let my colleagues take over and showcase actually what exactly goes into a charge mastering more in deep dive territory.
Thank you. And then I will introduce the hospital charge master, also known as the charge master or charge description master CDM. The hospital charge master lists the cost of each product and service offered by the healthcare organization, including any procedures, services, supplies, prescription drugs, and the diagnostics tests provided by the hospital. The hospital chart master on the right is from UCLA Medical Center. We can see that it contains the sites, a hospital name, type of service, revenue description, and rates. And next slide. We will talk about how the hospital charge master works. The first, when a patient receives service from hospital, the healthcare providers documents the encounter in the medical record. Then hospital staff, like professional coders, assign the service a code or reporting and the claim submission. And the codes are sent to the charge master. Each code is matched with a specific product or service and a fixed rate. Then the charges are billed to the patient, creating a claim for payers like insurance companies to pay. And next slide. Next, we are going to break down the hospital charge master data example. The department number reflects the department from which the service, drug, or products were supplied to the patient. Department numbers are hospital-specific and not nationally standardized. Charge code, and it is a unique code that identifies a specific charge for a specific device, service, or drug. No two charge codes are the same. And the charge description, these are text descriptions that identify the item or service being charged. The charge descriptions are hospital specific, and the revenue codes are universal and not hospital specific. All hospitals across the country use the same revenue codes. They are established by the NUBC. The CPT or HCPCS. CPT are created and maintained by the AMA and are universal across all hospitals. HCPCS codes are created and maintained by the CMS. These codes represent the particular service or item that you are charging for, but may also have specific payer requirements. The modifiers are specific to particular codes, with the most prevalent ones being for literality. The price is the price the hospital charges the patient. And next slide. And then we will talk about its role in contracting with payers. First, it is the basis for billing and negotiations. This list serves as the starting point for billing, and it is crucial during negotiations with payers. Hospitals use the charge master rates to negotiate payment rates with insurance companies. Charge master services are heavily marked up to make negotiations with insurance companies easier. And second, it can be used to determine reimbursement rates. During contract negotiations, payers and hospitals discuss and agree upon reimbursement rates for various services listed in the charge master. These negotiated rates determine how much insurers may pay the hospital for services provided to insurance patients, and they often differ significantly from the listed charge master prices. So the impact of the charge master is such that those with good insurance or better access to means to afford quality health pay the least for that care. Conversely, uninsured and others who pay out of pocket for healthcare pay the full charge master list price for the same services. And next slide.
So for this part, we just want to do the hospital charge master transparency. The overview of it is that each hospital should submit 2 copies annually on the July the 1st, a list of the 25 common outpatient procedures provided by the hospitals and an estimate of the increase of the in-gross revenue due to the price increases. The second one is about the licensed hospital required to make a copy of charge master on the physical location or the online. The last one is about HCAI required to collect 2 copies, which I have mentioned before, which is yeah. So how to submit the charge master? There should be basically there should be 3 steps: a copy of the each charge master as the June of the 1st, a list of its average charges for 25 common outpatient procedures, and The third one is about an estimate of the percentage change in the hospital's gross revenue due to the any price, just the same as I mentioned on the first slide. So all these three documents in one spreadsheet should be chart description, master estimate of the percentage change of the and average charges for the 25 common outpatients procedures by provided hospitals, and for separately, each of them has a content of it, and how to improve the price transparency. Hospitals can offer an online price estimator tool for as many of the 70 CMS specified shoppable services the hospital offers, and any additional shoppable services to reach 300 services instead of the display standard charges of at least 300 shoppable service in a consumer-friendly format. And non-compliant hospitals will receive a warning notice with instruction to correct the errors within 90 days. Hospitals don't complete the necessary step to achieve compliance will receive a civil monetary penalty. And the last one is about hospitals should prioritize the accuracy of their chargemaster. For the summary, there should be a hospital chargemaster include every services provided, from the surgical intervention and medical procedures to room charges and medical supplies. And the use of the chargemaster plays an essential role in the hospital revenue cycle management, as it's the starting point for the billing patients and insurers. There has been growing scrutiny and criticism of the hospital chargemaster for their lack of the transparency and the difficulty in the understanding how prices are set. Last one. A hospital chargemaster is a comprehensive listing of the items billable to hospital patients or a patient's health insurance provider. So for the last slide, it's about the appendix. It's the link for our references. Thank you.